What are the basic things that a worker needs? Staff welfare, reward for labor, prompt payment, and many other things like job security. Unfortunately, this is not the case in Asokorogeneralhospital, where security guards and sanitation workers, otherwise known as cleaners, all have not been paid, and it might interest you to know it has been on for 4 months, some even 7 months. In fact, you won't be wrong if you say it's over half a year since their last pay. Little wonder the level of security and safety of patients is under question, as you find just about anyone wandering in the hospital facility without proper identification and questioning. This neglect has led to the high rate of petty stealing of phones and patients' valuables. Well, that's a story for another day. Even the good book says a worker is worthy of her wages. Pay before the sun goes down. In this case, pay before a new month starts. Unfortunately, the story is different at the General Hospital Asokoro, also known as ADH, Asokoro District Hospital. Efforts to get the owner of the security company who controls the sanitation and security to talk has proved abortive. Furthermore, the level of care and attention a few bad nurses and doctors give to the profession is at an alarming rate, as a few bad eggs have become terror to the neonatal pediatric ward of the hospital, at least the one of which I am an eyewitness to. The unit, and indeed the entire hospital, is overwhelmed with workload. Probably this might be instrumental to some of their lack of compassion for patients, especially at the neonatal ward, as we call on the regulators of these very professional bodies to please swing into action before we hear the had I known mantra. There are key issues begging for attention. Security of lives and property at the hospital, staff welfare of security workers, more nurses and doctors needed for employment as Jakba continues. We really made efforts to talk to the owner of the company, the Eagle Security company that is in charge of security here. We wanted to ask about the staff welfare, what is the salary structure like, and all other factors that could maybe hamper the totality of their loyalty, their commitment to secure the facility here, where patients are at the mercy of intruders every now and again. Okay, it's another Monday morning here in Asokoro, and of course, right behind me you can see the Asokoro District Hospital, and reports reaching us on Green Nigeria Radio Show tells that there has been lack of welfare, no salaries, and it's over half a year, some even 3 months. And there were protests this morning, and they prevailed on us not to cover that they were working on the situation. And I have the owner of the company, the private company, who controls the cleaning, the sanitation, and security right inside, if you permit to talk to him. But we'll be giving you some track-ups if they are willing to talk on the program on what has been happening. Because if you notice, inside the hospital where I have a patient, sometimes you find stories of theft, petty stealing of phones, bags, and what have you. You find people strolling into the facility, going about with no proper identification. This and more has been the challenges in the Asokoro District Hospital. Whether this will be looked into